actually benefits from having a permanent makeup treatment?
Basically, anybody who wants to improve their appearance are going to benefit from permanent makeup. Our youngest client is 18 and our oldest client is 87, so it covers a complete spectrum of people. At Natural Enhancement, we have very talented specialists who can create results that are virtually undetectable, and therefore permanent makeup is also suitable for men. So you're going to benefit from it if you want to look good 24/7 and you've got a really busy lifestyle, if you're an outdoor sporty type and you want a long-lasting, durable makeup that can stand up to your activities. Perhaps you want to preserve your looks and you're looking for an enhancement that's going to make you look younger, then permanent makeup is a definite option for you. And if you find applying makeup a little bit difficult because your eyesight has deteriorated or your hand has now become unsteady as you've got a little bit older, then permanent makeup is perfect for that situation. And if you've lost your brows or you're losing your brows and your eyelashes due to chemotherapy, alopecia, thyroidism, or just the aging process, then we can restore the brows and give a definition around the eyes.
And Tracy, is there anybody that you wouldn't recommend having a permanent makeup procedure?
Yes, there are some cases in which we wouldn't recommend a client to have permanent makeup. One of those would be if the client was under the age of 18, and that's due to the legalities of tattooing a minor. Other certain medical conditions that would contraindicate a client having a procedure would be pregnancy and breastfeeding. That's due to the absorption of the anaesthetics that we use or the numbing agents that we use during the procedure. Diabetics who are on insulin would not be able to have the procedure, and that is due to the poor healing. People who suffer with the HIV virus because their immune system is compromised, and if someone currently had hepatitis B or hepatitis C, we would not be able to go ahead. Clients who have had an epileptic fit within the last 3 years would be contraindicated to having the procedure. And if you had an inflamed skin disorder over the area, for instance, eczema, psoriasis, or dermatitis in a localized area to where you are having the procedure, we wouldn't recommend that we go ahead with the procedure. Again, that is just in the localized area. If a client is using Accutane, which is a medication that treats acne, you would have to have completed the course of Accutane 6 months before we could do the procedure, because the skin is so sensitized when they actually take that medication. And if people are taking aspirin on a daily basis, ibuprofen on a daily basis, anti-inflammatories, the use of anti-boosts, you would have to speak to your GP and he would have to alter your medication program so that they could reduce the intake or stop the intake 48 hours before and 48 hours afterwards. This is because the healing of the skin and pigment retention is affected. We've got many clients who do take these medications and they do go to their doctors, and we have very, very successful results with them if they follow this program. If a client has had previous healing complications, then we would always ask for a doctor's consent. And if someone is going to have an eyeliner procedure, if you've had ocular herpes or you've got cataracts, then the treatment would be contraindicated. You've got any medical condition that you are concerned about, discuss it with your technician during your consultation, and she'll settle your mind. She'll advise you what's appropriate to do so that you have a successful treatment, or if it's best that you don't go ahead with having the procedure.
Tracy, what happens if a client isn't happy with the procedure or the treatment that they've had done?
During your consultation with your specialist, careful planning and good communications between the two of you will avoid this situation. Obviously, you're going to explain the look that you want, and she's going to give her professional advice, and therefore these situations are avoided. But if a client did find themselves in the situation where they were unhappy with the results, we can over-tattoo the area with removal agents, and these accelerate the fading process and lift the pigment out of the skin. However, we cannot do this for eyeliner procedures.